Hi, welcome. Thank you for joining myself, Adam Cartwright. I'm one of the digital imaging specialists here at Dentsply Sirona. We're going to talk about the sort of commercial overview and benefits of CBCT in your practice. And joining me to go through this is David Cunningham. And David, I'll let you introduce yourself with some more detail.
Hi, I'm David Cunningham. I'm the Clinical Director of Springgrove Clinic Dental Practices in West Central Scotland. I'm a hands-on restorative and implant dentist who's been in practice for about 30 years, using Sirona products on and off for the past 10 to 15 years of those, with full CBCT facilities in the last sort of 18, 24, 36 months sort of time period.
Excellent, thank you for that. So I was going to ask you how long you've had your scanner, so it's sort of getting on for 3 years now.
Yeah, we've had it for about 3 years. I spent the first 4 or 5 years or longer than that of my implant career with referring out my CBCT scans to other people to carry out, which was okay. We had some issues and some frustrations with the how smoothly that went, and also I think that patients were sometimes surprised that if you were carrying out implant dentistry that you didn't have all the facilities required, and the minute you said you'll need to go somewhere for a scan, it was as if they were going to a hospital rather than just another practitioner who had a scanner. So that led me to the long process of convincing my finance director that it was in fact a good idea to spend money, because she spends her entire time telling me not to spend money. So we'd been successful with the chairside milling and digital, so we were used to making a decent investment over a period of time. So that was my kind of thought process about how we would present it. And from a business point of view, although it is a tool we acquire, you're obviously going to ask yourself, do you really need it? Do you really need one? And did we lose very many implant cases because we had to refer people out? Probably not that many, but I think they were delayed and they were slower, and there were aspects of it that went out with our control, which meant that the brand experience maybe wasn't quite as good. And having now had one for a while, looking back on it, it probably was quite inconvenient, although we managed around that inconvenience. But it was definitely better to have it. So we picked up our scanner in March 19, round about that sort of time. And we did a lot of scanning within the first period. A lot of which had built up a backlog, because I knew the scanner was coming, and I'd said to patients, look, you can go for a scan now, or you can wait. Oh no, I'll just wait until we get your scanner, David. So they would wait. So we had a big sort of influx at the beginning, and I did wonder if that was my concern. Would this be, something we used? It was a bright shiny thing. Oh, we've got a scanner, and then the next thing it gets parked and doesn't get used, and that would then start to spoil the plan. But no, it was a consistent, constant flow of patients towards that, as was the benefit of having it on site. Started to become evident really quickly, and the other aspects of that, be it oral surgical, be it endodontic, be it the fact that it's got panoramic facility built in, those aspects became really clear as to being benefits additional to what we'd originally set out to buy.
Yeah, fantastic. And you talked about that sort of financial decision of trying to justify it to yourself and to the others within the business.
Yeah.
Has there been much of an impact? So since you went from referring out, in terms of those financials, have you seen some impact and benefits to the practice? I would say
it's significant. I think it makes the management of the costs of it easier. So everything's held within house. It's easier to follow the trail of that patient, because you're controlling the scan, you're controlling the timings of everything, but also you can directly see. So I would say we have an almost probably 95% uptake now of treatment of patients for whom we've provided a CBCT scan.
Fantastic.
Whereas before, it was high before, because a lot of people it's a destination practice, and a lot of people were coming to be treated, so they just thought, well, if I need to go somewhere else, I need to go somewhere else. But it's definitely taken away a percentage of patients that we would have delayed delayed treatment.
Yeah.
Looking at it from a business point of view, it's a very simple equation that we did. We worked out how much does this thing cost, how long are we going to pay for it over, what's the overall cost of purchase of that machine going to be, what's the annual cost of running that machine going to be, and what's the cost of the facility to set up to be able to use CBCT, as any business dentist would do, and we worked out what we would be needing to generate in order to cover the cost of that, and we had planned to do that over the period of purchase of the machine. We thought, well, if it takes us that period to get our money back on buying the machine, we'll still have generated the implant dentistry, the oral surgery from the CBCTs. However, having very, very quickly, and I was having a flick through because we spoke about this in Benzeme and at Sirona before. Very quickly, I think from the first 39 scans that we did, I think we generated £150,000 worth of implant dentistry. That phenomenal. Is probably slightly more than that if you think about the other stuff that was built into the treatment plans. Because we were doing implants meant we could be doing X or Y or Z. So, and that I think that is where, for me, the relaxation happened with the financial people in our business. My accountant has no issues with us having a CBT scanner. In fact, he probably looks at me and thinks, why did you not have one of these before? Same as he does with a CEREC machine. And I don't work for Sirona. I'm not. I've got respect for the company, but I don't have shares in Sirona. So I've got experience of CEREC that I was resistant to, like lots of people are. And now that forms a core part of what we do, and it's proven to pay for itself. I've got 2 full CEREC systems, and my CBCT scanner has long since paid for itself already.
So have you got any sort of figures you're able to share with sort of, what it's done in terms of financials, what sort of money it might be generating?
I reckon that for it's probably for every 150 scans, for every 300 scans rather, for every 300 scans, I think you're probably generating, if you're doing 1s and 2s implants with restoration in-house, that's probably generating £1 million worth of implant dentistry. Wow. in that period. The other aspect of it is that it's developing a huge reduction, and I don't know whether you can put a price on this, a huge reduction in stress for certain procedures. So that, a very, very well experienced implant dentist said to me once that you needed to do at least 500 implants in the mandible not to be terrified. Now he must have done 2,000 or 3,000 pre-scan days, and now exclusively uses a CT scanner the same way as we do. Yep. So all of that stress over all of those procedures has been removed from having that on site. In addition to that, the ability to scan impacted wisdom teeth, to look at periapical radiolucencies, to see whether in fact what looks one way on a 2-dimensional image on an intraoral radiograph is in fact often we've found, wow, that looks completely different in 3 dimensions. Maybe it goes much more medially, maybe it goes much more it's a load of it, or it extends around the roots of other teeth, or it doesn't extend as far as you think it does, or it's an artifact, or it's, all of those things add enormously. Would you buy a CBCT scanner in general practice because you wanted to look at impacted 8s and radiolucent areas around the tops of teeth? Probably not. But if you've got the implant idea and you're starting to incorporate that, because bearing in mind that my experience has been that patients don't think that dental implants are any different from a filling. They just think it's something a dentist does.
Just another treatment.
It's just another treatment. They want, it's as a very, very good salesperson that I know said to me quite recently actually, people don't actually want to buy a lawnmower. People want stripy grass. So they assume that dentists can produce everything. So being able to do these things on site is hugely beneficial. Yeah. The other thing I would say as well is that the huge off-putting part for an implant dentistry and in CBCT scanning is the initial outlay. And I think that the cost price up front of the implant of the CT scanner it's probably the most off-putting factor.
Yeah. And I love that analogy. You know, must have been a really good, well-educated person you got that from. But I say we were also chatting just outside before we started about that whole, you know, the referral side of things and that decision when you thought was the right time to invest in your own scanner. And I think we were sort of chatting about it's probably only about 5, maybe somewhere between 4 and 6 patients a month that you're referring out.
Yeah.
And that probably covers the cost of buying your own scanner in the
without,
practice.
without doubt. We were referring a lot more than that out. But if you're doing a moderate number of implants in practice and you're an ethical sort of person, you're going to want scans. You're going to want that information. You're going to be referring out 4 or 5 scans. Those patients are then going to be paying between £100 and £300, depending on where they go, for that scan. It doesn't take very long for those patients at that rate of going out of your practice. Effectively, they're buying somebody else's scanner,
Yep.
and that in itself probably isn't enough of a reason to do it. But the fact that they're buying the other person's practice brand, their other person, everything about it takes it away from your business. The other thing that's interesting as well is we have a number of practices in our group.
Yeah.
And a patient said to me something quite interesting recently. It was a referral patient from one of the associates in one of the Perthshire practices, and the patient is a patient of one of the rural practices. And I've seen the patient in the rural practice for consultation, came to Glasgow for their scan, and the patient said to me, I think I'll just come to Glasgow to get my surgery done. And I said, why do you want to do that? They said, because as I've gone to the different clinics, the level of equipment and the amount of equipment seems to have got more impressive and more technical and I had to reassure the patient that the scan was taken and it shows up in NEPC and all our clinics are capable of providing that. But that perception of your business and that confidence to know that, for example, there'll presumably be a senior person inside an organisation that's making those decisions, and he may have younger members of the profession working there. So supposing you've got a younger dentist who's having difficulty with dental extraction or who's got a problem or there's something, having that facility and being able to read that from an ethical point of view is massively important as well. I really think it's an essential piece of equipment in any modern dental practice.
Yeah, and you touched there sort of a couple of questions ago about how you sort of take a scan initially for implants, and that initial drive for getting a scanner was around the implant dentistry, but you're now finding it useful in other fields.
Yep.
I think there was a study published recently that says within the next 3 to 5 years, I think there's talk of endodontics is probably going to overtake implants in terms of the use of CBCT.
Yep.
So you're sort of finding this useful now in wisdom teeth and implants?
Yeah, wisdom teeth, implants, endodontics. Our endodontist is interested in I think the technology for that is rapidly advancing, and I very much agree. One of the drivers in our clinics for having our own endodontist who had specialised in endodontics was, aside from they'd probably done 3,000 or 4,000 hours of postgraduate training in the subject that I hadn't done, was on my master's course seeing 3-dimensional imagery of molars and first and second molars, and looking at all these canals and thinking, I wonder how many of those I actually routinely filled when I was attempting to do endodontics. Yep. So yes, from that point of view, also from an overall scanning point of view, overall screening point of view, I've seen a number of sinus things, number of sinus lesions that have been referred on to ENT. It'll help you establish a really good, my advice to anybody with a scanner is get a good connection to a good ENT consultant who can take it from you to go to the next stage. If you've got cloudy sinuses or if you've got something that's concerning you, that's really, really beneficial to have that. It also saves the patient a huge amount of time, even in a private setting, because you can give the person the scan and they can take the scan, and the ENT surgeon will love you in the NHS if you can produce the scan there and then. You can say there you are. You know, if you're referring somebody for something acute.
Yep. Know? So you're now 3 years down the line of having your own scanner, and I remember when we first met 3 and a bit years ago, and you were sort of looking into a purchase. You know, you've got the experience of the use and also having looked around at what's on the market. And you know, the field has developed a lot. There's lots more features, there's lots more functions, and machines have moved on. How were you able to kind of look at the market and the message that was out there and work out sort of, you know, what you ended up considering was expensive, but compared to what was sort of good value for money?
I think that's a really good question, and I think any GDP or any dentist who's having to buy their own kit is terrified they buy that equivalent of the cheap toasted sandwich maker that ends up underneath the cupboard in the kitchen where you put all those things you don't use, don't work very well, they're a bit unreliable.
Only that idea at the time.
Yeah, only that. Yeah. Only that individual dentist knows how to operate it because it's all very difficult. I wanted something that was of high quality. I wasn't going to get an electric shock off it when I switched it on. Also, that if there was an issue with it, I would be able to access assistance from reputable companies who are supplying this. We were lucky enough with our supplier and our IT partners to be able to get a really good install and a really good buying procedure, and they were very sympathetic to the way that I wanted it to be. So was I going to when you're talking about, you know, when you're talking about buying something that's going to cost you 1,200 quid or whatever it is a month, I don't know what it costs you, whatever, depends what you finance it, and it's churning out that volume of work over a period of time, it's kind of irrelevant, and it's kind of irrelevant. You're going to think, I'm glad that I bought the one that I've got some comeback on. And I will say this, that I am not IT, and I'm not interested, and it's to me, it's just something that I need it to work. We have had zero issues whatsoever with our Sirona scanner. I think, like everything else, however, that having a good relationship with your equipment partner and your digital manufacturer partner as well really helps as well. So we've been fortunate in that. Choose your suppliers wisely. And I've never regretted, I've never ever thought about the price. I think it's like lots of things in life. I don't think you necessarily analyse the price of anything that works really well for you. It's kind of yesterday's money, and you think, well, I'm glad I bought that. What I have seen is a number of people change from cheaper scanners who've gone to more expensive scanners, and in the end, the net effect of those is they've spent a lot more time and a lot more grief trying to get the thing to work properly. And that comes across in training as well. You know, from having come to our facility in Glasgow, that whole thing is run by our clinical team. Every aspect of that, and across all the skills of that group of staff members or team members, all of them, they never complain about how difficult it is to operate. Not
Fantastic.
At all. It's got aspects of it I don't use, and it's got aspects of it I use more than I thought. But that's not to say that some of the aspects, like the larger field, etc., I just haven't got round to using as yet. I know there's a lot more in that to come.
Okay, so for the people that have joined us to watch this session, that may be considering, you know, their own purchase of CBCT for their practice, what would kind of be your top tips of what should people do? What would your advice be for anybody thinking about CBCT?
I think you would need to make a very hard clinical decision that is backed up by the numbers. Any decision you make in a business, you need to be comfortable with the numbers, because if you've not thought about that, you're flying blind, you've no real idea. You might mean you undervalue something that's actually very valuable to you, or you overvalue a procedure or an activity or a piece of equipment that's actually costing you more than it's making you. So I would strongly advise you do that. I would strongly advise that you look at across the board. What's interesting is that it's like many things. Your interaction with the manufacturer will give you a really good indication of what your experience is going to be like. And that was what I looked at, 2 or 3 highly thought of brands. And I've got some very esteemed colleagues who use these brands. It may just be the people I interacted with, but I didn't find, I found what really mattered was I got the answers I wanted when I got them. I also, people that are prepared to understand the setting in which you're going to put that scanner, and also that are not going to disappear once you've done that. That's what's important. And I think price is important, but I don't think it's the most important. And I certainly don't, and I know that anybody looking at quality high-end CBT scanning isn't looking for the cheapest implants they can find on the market. They're just not. They're not buying copy implants, you know, on eBay. You know, they're looking at quality stuff, and they want the same thing. You want the same thing from your imagery because it makes your surgery easier. It just makes everything easier. So that would be 100%. Don't be guided by price. Obviously, nobody wants to be paying too much, but I don't think that's at the top of your priority. Okay. Certainly wasn't at the top of ours.
That's fantastic. So for anyone that has been joining us, you know, sort of bear that in mind. Following this session, obviously don't forget to come and join us in the networking lounges where you can talk to some of your peers, you can talk to some of my colleagues, and maybe have a chat about what you've listened to today. So thank you, David, for joining us today.
Pleasure.
And thank you, everybody else.